97.3 KKRC, Sioux Falls' greatest hits. Alan Helgeson hanging out this afternoon. Don't know if you caught this in the news. I think things really started when I had a skiing accident, probably around 2006. I had a torn meniscus. That was repaired, but that kind of started things. And then we had done the things along the way to take care of all the conservative measures. We cleaned things out. We did the PT, we did the shots.
He went from getting months of relief with a corticosteroid injection to weeks of relief with a corticosteroid injection. That's more frustrating, and that's more difficult for patients usually, and it was more difficult for him.
Well, we've laughed about it because it's been that long that I've avoided having anything done with it. But met with Dr. Kimber today, and we finally set a date that I'm going to get my knee replaced. It's kind of weird, hasn't really sunk in yet, but...
Finally, his pain was impacting his quality of life, and he couldn't do a lot of things that he wanted to do without taking a break because his knee hurt.
Coming into my workplace, and we have a flight of stairs up to where my workspace is, and I take the elevator every day. And I'd like to not think twice about that.
When you have knee pain that's limiting your ability to ambulate, get around, do what you want to do from an exercise standpoint, it's time to get surgery done.
126/62.
Oh, I need more coffee.
We always like to do a pre-op physical to ensure that we minimize the risk of complications during the surgery as much as possible. And it's important to kind of go in with an informed decision and be able to decide what's the best for you. In the end, it's your knee, and it's your joint, it's your health.
Okay, so it's Sunday morning, November 2nd. I did the joint class for the Center for Joint Success on Wednesday, and they did a great job of going over all the things before, during, after surgery.
Once the surgery's done, what are the things that I need to know to make sure that everything goes nice and smooth for me?
If you go into it thinking, oh, it's just something, it isn't. It's a major deal. And the fear is, it's real. And that's why I think that they do the class, so that you can really be prepared for it. And I'm so glad that I was able to bring my wife along. In fact, they make sure that you have your coach with you, because you need support with this. You need somebody that can go along this journey with you. I do have to tell you that I did have a short period where I almost pulled the plug on having it done. 3 weeks ago, my dad passed away, and that was very, very difficult. My dad had both knees done several years ago, one done, and then 6 weeks later had the next one done. So he absolutely would have said, do it. Yeah, he would have said, what are you doing? I could find all sorts of excuses to get out of it and to not have this done. And I thought about that and said, I need to get this done. There's never a good time to do this, and I'm going to do it.
2 more things for you to do before getting dressed.
That day was something else. I had no idea the kind of care and the team that would wrap around me to do all the things to get me through that. I've worked in healthcare for 20 years, but then you see these things, and I was just awestruck at the little attention to detail that they're doing to things like this. I'm going, why are they doing this?
That'll help a lot with the pain.
It made me feel so good and trust in the confidence of the surgical team at Sanford. It was just great.
Well,
Here we go.
off to see the wizard.
Hi, everybody.
Hello, good morning.
He got a very standard knee replacement. We did have to take a screw out because he had a screw in from his previous surgery, but that was the only thing we had to take out. Everything else we were able to leave in there. We then also put a plastic piece behind his kneecap. The reason for putting the kneecap there in his situation is he did have enough arthritis behind the kneecap that I didn't want that to continue to be a pain generator for him.
I can't believe I'm doing this.
Yeah, you're doing great.
I can't believe this is happening. That still is just unreal to me. I'm thinking, there's something, you put something that wasn't in there 2 hours ago in between my bones, and I'm using that to help walk. I had lots of moments like that doing things for the first time with the new knee afterwards, things that in my mind I didn't think I could do. The physical therapy I had while I was in the hospital, like none other. They prepared me so well for when I went home. It was just out of this world. Well, hi there. It is December 3rd. It's a Wednesday, and 24 hours ago at this time, I was in the operating room at Sanford getting a new knee. So exciting. I'm just excited. It feels like, okay, let's get going here, and all the things that I want to get doing that having the knee pain just kind of held me back from. It's on me. The work is on me to get going, and I've got the new knee. The experts have given me a new knee and told me what I need to do, and now the work is on me. So it's kind of cool.
Well, Alan comes in, a couple of days post-op, obviously pretty stiff and sore. Came in, I would say, with a smile on his face, which is good to see.
Morgan was great.
Typically, in these total knee situations, we like to give them exercises right away. Alan was a rock star. He was doing everything he was supposed to do. Typically, the first couple weeks, patients are using the walker. They're moving pretty slow. With Alan, I think it was 2 weeks, and we got him onto a single point cane, which was a big milestone for him.
It is Sunday, December 21st, and I'm in my recliner, and it's going good. I am doing therapy, PT, which has been great. PT is really the secret sauce, and it's been doing such great things on great exercises. So I really appreciate what PT's been doing for me.
Go. Ability to get up and down steps, that was a real challenge for him, and it's been a challenge for years. The first time I put a step in front of him and said, Alan, I want you to step up with your surgical leg, he looked at me like I was crazy. And it was a 4-inch step. And I said, you can do this, We got through that, and we eventually went to a 6-inch, to an 8-inch step. And he not only did it, but he did it well. And that was a big thing for him.
They are like the joint whisperers. I don't know how he knows, but he knows. Every time I left PT with Brett, I came out always feeling better, always feeling better.
And attitude is everything. If you come in with an open mind and let's do this mentality like Alan did, it makes my job so much easier. Alan's one of those guys, I didn't have to motivate him.
Good morning. So it's Monday, January 5th. A lot of kids are going back to school from Christmas break, and I'm going back to work. So I drive a big old pickup truck, and I'm thinking, how am I going to get in this thing? And the first time I did it, I just drove around the block. I drove yesterday and no issues at all. So I'm going to drive and get back to the office a week early. Nobody knows I'm coming in. So I'm super excited to see my coworkers and get back into the office. It was just the best thing ever. I mean, I don't run up the steps, but I take the steps, and it just feels good to do that and not have to stop because there's pain in my knee. Good morning. It's Tuesday, February 3rd. Today it's 9 weeks since I had my knee surgery. And the reason I wanted to do something quick this morning, it's kind of a big deal today that I left my cane at home. And that's been kind of like my security blanket, and I probably haven't needed it. So that's kind of a big change for me. So I can do this.
That's what drives us. I think that's what drives a lot of PTs is seeing that, that point A, that lowest point. First day after surgery, I'm stiff, I'm sore, I can hardly walk, I can hardly move, to point B. Up here, I'm feeling great, my pain is controlled. I'm walking great. I'm getting back to me. I think the day after him and I wrapped up, he stepped onto a cruise boat. That's what it's all about, is getting back to what you want to do.
We went to the Caribbean in April. I have a real fancy walking stick that has like stickers on from all the places we travel. But for the most part, I didn't really use the stick a lot because I didn't need to. I didn't walk 2 blocks and my knee hurt or got stiff or swollen. And that's such a great feeling. I don't have that fear of my knee just tiring out anymore. If you're struggling with knee pain, if you've waited or you're afraid or you're scared, if you're hearing this, you're scared about doing something about your knee pain, don't be afraid of it, because the Sanford orthopedics team, they've got your back, or I guess they've got your knee.
When you're comfortable with it, we're here for you to help you and try to do the best we can to make things better for your knee. One of the most rewarding things about what we do.
That's what gets me up in the morning, and I love it, man. It's pretty special what we can do.
Oh, buddy,
You
appreciate
betcha.
it. You're the greatest.
Yeah. Love you. Love you too, man.
We're still getting to know each other, me and my knee, and the journey is different for everybody. But my quality of life, I'm so glad I did it. I really am.